Let them be a listening ear for the challenges that you are experiencing. If you would like to speak with a mental health professional, you can text TALK, T-A-L-K, to 552020. Again, text TALK to 552020. Or for Spanish language, you can text hablar, H-A-B-L-A-R, to the same number, 552020. Again, this service is free to use, and it's available to you no matter your personal circumstances, and you will remain completely anonymous. You can also access a wider array of supports using the same number from your mobile phone. You can text that number, 552020, with keywords such as unemployment, or food, or shelter, and you will receive information back to help you navigate getting assistance. My administration is here to serve you and to help see you through this time of crisis. This text line is just one more way that we can meet you where you're at. In a few moments, Assistant Secretary Kia Coleman will talk more about the many ways in which our Department of Human Services is working to strengthen mental health services throughout the state to make them more available to you in these trying times. There are many of you who may be saying to yourself, I'm taking all the right precautions, but what happens if I get symptoms? Where do I go? Who do I see? Well, I want to provide you with answers to that. From what we know so far, the vast majority of people who get COVID-19 are able to stay home and get better on your own without requiring hospitalization. But without some medical advice and guidance, the prospect of managing this illness at home may seem unnerving and truly daunting. That's why today I'm announcing a remote patient monitoring program specifically to serve those potentially infected with COVID-19 who will be able to recover from the safety of their homes. Through this program, health workers will digitally connect with you when you're experiencing COVID-19 symptoms, but do not require an emergency or inpatient care. Patients will receive daily virtual visits and receive wellness kits that include things like thermometers and pulse oximeters, blood pressure cuffs, and alcohol wipes. This program serves to reduce barriers to physical health and mental health services in all communities and income levels, especially underserved communities and those most at risk during this pandemic. And because patients are served in their home, this program will also help limit the spread of the virus and safeguard hospitals from being overwhelmed by keeping those who can recover at home staying at home. This new program is available for anyone and everyone in Southern Illinois and Central Illinois and will be available soon throughout Northern Illinois during this coming week. In Southern and Central Illinois, I'm incredibly proud that the Southern Illinois University School of Medicine is our partner, serving communities around Carbondale and Metro East, Quincy and Decatur and Springfield. The hotline for that program is 833-673-5669. Again, the hotline for those areas in Central and Southern Illinois is 833-673-5669. And that number will be live on Monday. I'm also deeply grateful to our partners at OSF Healthcare, which will serve Central and Northern Central Illinois communities such as Alton, Peoria, Champaign, Urbana, Monmouth, Ottawa, Bloomington, and Pontiac. The hotline for the Central Illinois program is 217-545-5100. That's 217-545-5100, and that hotline is available right now. Finally, I want to talk to you about our children. As we've seen, children are susceptible to COVID-19, but a high percentage are much less likely to suffer the more difficult physical effects of the virus. And for that, we're all incredibly grateful. But no child has been spared the upheaval that COVID-19 has brought to their daily lives. I've heard from many parents who are concerned about how our children and adolescents are processing and managing what they're seeing and hearing and feeling about all of this. It's important that we engage our children in these discussions and make sure that they know we're thinking about them constantly. To begin to address this, I'm co-hosting a special event today with Lurie Children's Hospital for children's childhood resilience, the Illinois Children's Mental Health Partnership, and MICVA Challenge. At 5 p.m. today, I will be hosting a virtual town hall meeting for kids of all ages. It's being hosted on Facebook Live at the Lurie Children's Hospital's Facebook page. I'll repost the link on my Twitter and Facebook pages to help guide people to the site. I hope that kids from all across Illinois will join us there. Thank you, and I hope you're all finding some joy in this Easter weekend. I want to let you know that I will be holding my regular daily update tomorrow at 2:30 p.m., although it will be brief. In the interests of giving Dr. Ezike a happy Easter with her family, she will not be with me tomorrow and instead will rejoin us on Monday. And now I'd like to turn it over to the doctor for today's medical update. Dr. Ezike.
Thank you, Governor, and thank you for the day off. Good afternoon, everyone. I know I've been repeating the same message for many weeks now, but today will be no different. It's important that we all know that the decisions we make today have real consequences, and they extend beyond ourselves as individuals and affect our entire community and our state. Tomorrow does mark Easter for those who celebrate, and this is a holiday where many are used to congregating together with friends and family and the church community, but this Easter is different. Easter 2020 will go down in history as a completely different type of Easter, and it's not one where we'll be able to commune together. Please enjoy your time at home and keep your community safe. Let me be clear, if there are churches that were planning to convene tomorrow, please cancel now. We can't risk spreading the virus through this church congregation. We do have evidence of people who got sick through attending church and other similar gatherings. Let's not do that. Unfortunately, I must report that 81 additional lives have been lost in relation to COVID-19 and that there are 1,293 new cases. In total, that's 677 lives that have lost the battle against COVID, bringing us to a total of 19,180 total positive cases. I am lifting up the memory of every individual who's no longer with us. Our sympathies go to the families and the communities that are bearing this loss. Of course, there are grandmothers, there are grandfathers, there are teachers, there are police officers, there are pastors, there are state employees. Death has hit the same family, sometimes multiple times. Reporting these deaths is not easy, as you can imagine, but it is my duty to share with you the information that you need and to make sure that everyone is clear that this is a serious situation that we're all facing. This pandemic is unlike anything anyone currently living has ever seen. Every possible effort is being taken to ensure that we are keeping Illinoisans as safe as we can from this virus, from increasing testing capacity to trying to blanket the state with available PPE. Every state agency is working in lockstep for the betterment of Illinois. And of course, we have our local health departments and so many community agencies that are so critical to this effort as well. The support we have received from individuals signing up to volunteer through Serve Illinois and licensed medical professionals answering the call to get back into the workforce is nothing short of inspirational. These are the actions that make a difference in our fight against COVID-19. The actions that you take as individuals is probably even more important. Again, what we do today will guide our path and affect our curve. Stay home. And the people who have, you have made an impact in this fight already. We have to stay the course. There's no doubt that we will get through this pandemic, but it is a long marathon. We can't grow tired of washing our hands. Despite the cabin fever, we still need to stay at home. We still have a long road ahead, and we must endure with patience until we get to the other side. As I end today, I want to remind you that you can text the word COVID to 312-500-3836 for updates on COVID-19 delivered directly to your phone. Thank you for taking the time to listen. And with that, I will summarize comments in Spanish. Buenas tardes a todos. Me han escuchado repetir el mismo mensaje durante estas 5 semanas pasadas y hoy no será diferente. Es importante que todos sepamos que las decisiones que tomamos hoy tienen consecuencias reales que se extienden más de nosotros como individuos. Mañana es Pascua para los que celebran. Una día en la que muchas están acostumbradas a reunirse con amigas, amigos y familias. Este Pascua es totalmente diferente y no es el momento de hacerlo. Disfrute el tiempo en casa, mantenga segura a su comunidad. Déjame ser clara. Si hay iglesias que planeaban reunirse mañana, cancele ahora. No podemos arriesgarnos a través de este mecanismo. Hoy informo que se ha perdido 81 vidas adicionales en relación con COVID-19 y hay 1,293 casos nuevos. En total, se han perdido 677 vidas en esta batalla y ahora hay 19,180 casos totales. Levantamos la memoria de cada individuo que ya no está con nosotros. Nuestras condolencias van a las familias y comunidades que están sufriendo estas pérdidas. Comprende que se pierda abuelos, maestros, policía y muchas más personas de la comunidad. Reportando estos números nunca es fácil. Es mi trabajo compartir con ustedes la información necesaria para ayudar a convencer a todos de que COVID-19 es muy serio. Esta pandemia es nada que alguna persona viviendo ha visto en su vida. Se están haciendo todos los esfuerzos posibles para garantizar que mantenemos a la gente de Illinois saludables de este virus. Desde aumentar la capacidad de pruebas hasta cubrir el estado con el equipo de protección personal, cada agencia estatal está trabajando en conjunto para Illinois. El apoyo que hemos recibido de las personas que se inscribieron para ser voluntarias a través de Serve Illinois y los profesionales médicos con licencia que respondieron a la llamada para volver a trabajo es nada menos que una inspiración. Estas son las acciones que marcan la diferencia en nuestra lucha contra COVID-19. Las acciones que tomen como individuos probablemente sean más importantes. Una vez más, lo que hacemos hoy guiará nuestro camino en el futuro. Quédense en casa. Ya han tenido un impacto en esta pelea. Si mantenemos el rumbo, no hay duda de que pasaremos esta pandemia. Pero esto es un maratón. Tenemos un largo camino por delante y debemos aguantar con paciencia hasta que podamos llegar al otro lado. Al finalizar hoy, quiero recordarles a todos que envíen un mensaje de texto con la palabra COVID-ESP a 312-500-3836 para recibir más información sobre COVID-19 directamente en su teléfono. Gracias por tomar el tiempo de escuchar. And with that, I will turn it over to Kia Coleman, who serves as the Assistant Secretary for the Department of Human Services.
Good afternoon, everyone. Thank you, Dr. Ezike, and thank you, Governor. I would like to echo the Governor's appreciation for the community mental health centers across the state. The 211 of them are, 62 of them will be answering the call for CALM that you heard the Governor mentioned, and will serve as a support for Illinois residents in response to texts to 55-2020. This network of providers includes organizations that provide specialized mental health services for children, older adults, and individuals. They are our partners every day of the year, and during this crisis, they continue to step up to meet the needs of Illinois residents. As has been shared over the course of the past several weeks, the Illinois Department of Human Services has balanced the need to practice social distancing while also continuing to provide critical human services for Illinois residents across the state. The needs of our communities have increased, and IDHS, with its community partners, are rising to the challenge in a swift and responsive way. The physical footprint may have changed, but we are still here. We had previously announced our Help Is Here website that is a one-stop place for people to learn about services and supports. The Governor announced today the Illinois Call for Calm tool that will round out DHS's Help Is Here strategy. We recognize that the mental well-being of Illinoisans is strained as a result of the pandemic. Lives have been upended. Children are home from school, and adults are working remotely. Additionally, many adults are unable to work at all, and people are scared. We would like Illinois Call for Calm to be another resource to address these fears and concerns. I would also like to share the other strategies that DHS has employed to promote the mental health and well-being of Illinois residents. This is unwavering even during this public health crisis. We are working on several fronts simultaneously. When this current crisis first arose, we took immediate action to safeguard the publicly funded mental health safety net. IDHS has committed to providing financial support to our network of community mental health centers, ensuring that their doors remain open and that they can continue to care for Illinoisans during and after the pandemic. DMH is in frequent communication with CMHCs and provides ongoing guidance and technical assistance as they adapt their practices to the current environment. Some of our state's most vulnerable residents are those with serious mental illness who require treatment in one of our 7 state-operated hospitals. DMH quickly mobilized to ensure that all precautions were taken to prevent the spread of COVID-19 in these facilities and to appropriately respond to positive cases if and when they arise. Approximately 3,000 Illinoisans with SMI live in community residential programs. DMH is providing guidance to these providers as well. IDHS recently announced an additional $1 million in funding to community residential providers to support their vital work during this pandemic. And just yesterday, DHS also announced an additional $1 million increase to support funding for mental health crisis services. I'd like to conclude by highlighting again the new Illinois Call for Calm resource. This can be accessed by texting, as the Governor mentioned earlier, talk to 55-2020 or in Espanol, hablar to 55-2020. If you want to talk to someone, you'll receive a text back, a prompt, to provide your first name and your zip code, and that's all you will need to do to be connected to someone. After you've been connected to a counselor, we will send you a satisfaction survey within 2 days so that we can continue to improve this new system. Additionally, as was mentioned earlier, you can text 55-2020 with other keywords and receive information that will help you navigate the many supports. We in Illinois want you to know that help is here in whatever way you need it, by phone at 1-833, the number 2, FIND, F-I-N-D, HELP, H-E-L-P, or by website at dhs.gov. health.illinois.gov/help is here, or by text, and I'm going to say it again because I hope that everyone uses it, 55-2020. As always, we are here at the Illinois Department of Human Services in the state to help and support you. Thank you.
Good afternoon. Thank you, Governor, for having me. I am Keshana Longs. I am a senior administrator at the Illinois Department of Health Care and Family Services. More than 3 weeks ago, Governor Pritzker recognized that expanded telehealth would be crucial for providing health care during the fight against COVID-19. In his COVID-19 Executive Order Number 7, the governor began turning the CDC's recommendation on telehealth into reality here in Illinois. These actions significantly lifted the obstacles to telemedicine for both Medicaid and private insurers. By acting decisively and broadly, early in this crisis, the administration has been ensuring that people throughout Illinois continue to receive the care and treatment they need, safely and effectively. The Medicaid program specifically expanded the kinds of services available for telehealth, including critical services like wellness checks, therapy appointments, and behavioral health care. It's so imperative during these times that our members continue benefiting from these services, which are so often absolutely critical to their well-being. We recognize that it's essential, for example, that counseling and addiction treatment services aren't interrupted because of this crisis. We also changed our rules to let our members use telehealth in much more convenient locations, in their homes, as well as in group care sites. We added more kinds of technology that can be used for telehealth. Today, a member can receive services with their tablet or their smartphone. They can use FaceTime or similar systems as well. Finally, to encourage Medicaid providers to offer more telehealth, we made sure they understand that reimbursements will not be reduced when offering these type of services. Fighting COVID is our highest priority. With expanded telehealth, we've been able to make sure that access to a range of care and treatment continues for people across the state. When they need to, residents should still go to their medical providers for prenatal care as well as immunizations. They should follow precautions when doing so, including social distancing and using masks. And they should make an appointment if possible. But for those who are able to use telehealth services, we strongly encourage them to benefit from their safe and effective approaches. I would just like to conclude and encourage everyone to frequently check the HFS website. We have a lot of updates constantly being developed and updated on the site to explain some of the initiatives that we have going on. Right now, I will introduce Dr. John Vozanelik, who will talk a little bit about the OSF program. Thank you.
Many thanks. I'm John Vozanelik. I'm the Chief Medical Officer for Innovation and Digital Health for OSF Healthcare System. It's a large healthcare system which extends from about Springfield, east and west through central Illinois, all the way up north into Evergreen Park. We've seen this COVID crisis hit Illinois in a unique way. And downstate Illinois is an incredibly resilient environment. We are a stronghold for you. We stood up a response that is available for you today through 1-833-OSF-KNOW, K-N-O-W, with the intent to connect patients to services. The services include an interview with a pandemic health worker, a layperson who has been trained to provide assurance and connection. This is a time, at this time of year, this springtime, should be a time of joy, should be a time to get out and enjoy family. And I, and many like me, have family members who are inside. They're worried, they're concerned, and they have limited access to services that they typically enjoy. Our pandemic health worker will connect to those patients. They will provide assurance and reassurance, but they're also connected to nurses and physicians. And if that patient who is in our program becomes ill, we'll extend services even into their home as long as it's safe for them to do so. I think about my family members, those who are spread across even the smaller communities of Illinois, and they're taking care of their family members as best as they can. OSF serves a role to provide essential services, but also human connection. I'm an emergency medicine physician by training, and I understand very well the critical need to care for patients in place for as long as we can care for them, and not to overburden the traditional healthcare environments. This is key to our survival and to the enduring healthcare population. We can take care of people during this COVID crisis, and we will. We will connect to them digitally, we will connect them with human beings, and we'll connect them with trained personnel who can care for them all the way up to the point where, if it is necessary, they can get higher level services immediately. I'm very proud of the governor's message today. I'm very pleased to see that others are standing up similar programs across the state. We serve a unique role in providing health care to those who need it most at this critical time. Governor Pritzker, I understand that you have some time for questions.
Yeah, thank you very much. Thanks, John. I have two things to say before I take questions. One is I want you to know that John and his entire team at OSF are doing a phenomenal job. I visited their headquarters, their nerve center for their telehealth operations, and it is very impressive. They have some amazing nurses and doctors who are on staff. They're ready to serve you as you may need, and I encourage you to use it as you will. I also want to say to all the kids out there that the Easter Bunny is officially an essential worker and will in fact be working tomorrow. So in case you were worried, the Easter Bunny will be there. So with that, I'm happy to take any questions.
All right, Governor, thank you. Lexi Suter with Channel 5 here in Chicago. The highest week we've seen with numbers. Do you know how many of these cases are requiring hospital care, and do you see the curve flattening at all?
So I will tell you a few things to watch in the numbers, and we'll be talking about the hospitalization numbers and the ICU numbers again as we have each week in the next few days. But what we're seeing is a flattening of the curve, and what that means is a lower rise in hospitalizations than was originally anticipated. That's a really good sign. Hospitalizations, ICU bed use, and ventilators are, the most real way you can track the way that the virus is moving and what effect it's having on our communities and whether it's increasing exponentially, arithmetically, or otherwise. And what we're seeing is a flattening of that curve. Same thing, you're talking about when you talk about cases and the death toll. These numbers will bounce around each day, and you've seen, we've had higher numbers than we had today. In previous days, we've had lower numbers. But if you look at a kind of a moving average of days, you can see that the rate of ascent has significantly diminished. Again, it's not flat exactly, but it's not going up the way that it was before at the same ascent level. So we're pleased by that, but by no means do we think that that is determinative of what tomorrow will bring or the next week will bring. Again, as we look at other models, a variety of models, you can see different peaks and different moments in which we need to bring more or less resources to bear.
LA County extended its stay-at-home order yesterday to May 15th. When will you be looking at, if you will, doing something like that here in Illinois or Cook County?
Really, we look at it every day, although I admit we don't have a meeting about that date every day. But I'm looking at the numbers and talking to Dr. Ezike about those numbers all the time. And so, we'll continue to do that. And as we begin to think that we may need to adjust that date, that April 30th date, We will then reach out, as I do somewhat frequently, frankly, anyway, to outside epidemiologists and scientists and get their input and talk to other governors who may be changing their dates and say, what made you do that? And try to, adjust appropriately. But you'll hear, I've tried to be as open and frank about all of that as possible, and I'll continue to do it.
All right. And this question is from WGN. You mentioned earlier this week that you were looking at a third-party vendor to help with the IDES website in order to help people get benefits faster and smoother. Has there been a vendor selected? Are they Chicago or Illinois based, and when will they start?
Yes, and they have already begun. So there are several things going on, and when we talk about an IDS vendor, there are two things that we're adjusting for. One is the massive numbers of people who are applying for unemployment in the traditional system. I mean, we're talking about multiples of what has ever been applied for at IDES. And so that's something that the system just wasn't ready to handle. And that's why we brought in outside help. We did that, very soon after it was clear that we were getting overwhelmed. And we have more people answering phones, and we have more people who are kind of keeping the system running. It has challenges. This is a 10-year-old system that works fine if you have a normal number, normal range of applications on any given day. But when you have days when 100,000 people are trying to access the system, it makes it more difficult. So we brought in outside help for that. That's one thing. The other thing is this new program of unemployment for independent contractors. That's something that never existed before, and the federal government provided resources for that, not for the building of the system necessarily, but for the for the independent contractors. We need to put that system up and in place. No state had anything like it because it didn't exist ever before. We're now building that system again with an outside vendor building it. We have a terrific team at our own Department of Innovation Technology that's working alongside them and making sure that as they stand it up that it will work properly for people here in Illinois.
Thank you.
Thank you.
It's only been about a week since the CDC recommended that people wear masks out and about, including yourself.
Yes, sir.
What have you seen out in public? Are you happy with results?
I have seen more and more people wearing masks out in public, and I'm very glad to see that. The more people adhere to these increased standards that are being put out, the more we are bending the curve. And so, look, as I came out of my own home this morning, there were people walking along the street. I would say 2/3 of the people that I saw were wearing a mask or a bandana or a scarf, and the other third were not. I want to encourage everybody to do so. Remember what you're doing when you wear a mask or a scarf or a bandana. You're really protecting everybody else, and they're protecting you by wearing one also. So this is something we're doing in mutuality with one another together. It's for each other, and I encourage people to think of their neighbors and their friends when they're putting on a mask. It's important.
What is the latest with PPE needs, ventilator needs? Is the state caught up? Are you still looking for more?
Well, so, every day I ask the question, if we have an unused something out there, why is it unused? And, and do we need fewer of them or do we need more? Because the peak might be higher than we expect. On the subject of PPE, let me just say that we are going to continue to need more. Even at the hospitals, and everybody is being supplied properly for roughly a 7 to 10 day period at a minimum for each hospital. And then behind them, backing them up, are their local county public health departments, which we're supplying also. So we're supplying directly to hospitals, and we're supplying the public health departments who can also give to the hospitals what they need, not to mention all the other institutions that may need them and the first responders. So we're the backup system for everybody, and we're also the direct deliverer to many of them. And I would say we're in constant need. We're trying to acquire millions of pieces of PPE, gowns and goggles and masks and everything else, and we're going to continue to need that. But the flow seems to be coming. I can never say at an adequate pace because I won't feel like it's adequate until we have big stores of it to back everybody up. On the subject of ventilators, we have looked across all of our hospitals, and in nearly every hospital there is ventilator availability, and certainly in every region. So if there ever is a hospital that might run out and use their last ventilator, there are ventilators within that region. We watch that closely so that we might be able to move those ventilators around or the patients. So we're out in the market trying to acquire more ventilators. We don't know exactly what we need. What we know is that the range that the models tend to tell us would indicate to us that we don't want to be wrong, and I'd rather have too many than too few. I'd rather be wrong in that way at the end and just say, we overestimated and we saved a lot of lives doing so. So we're going to continue to acquire ventilators until we sort of hit a number that we think is, a rough average of a high level of need.
Okay, we have questions from reporters online. This is from Amanda Vinicky at WTTW. Can you please share more details about how the remote monitoring program will work and the timing for its implementation statewide? Will patients be enrolled only after a positive confirmation? And how will thermometers and blood pressure cuffs be delivered? Will the state track data on patient recovery? Is there any limit to enrollment?
I'm sure, maybe I can hand it over to John to talk about.
Thank you. So the enrollment into the Pandemic Health Worker Program is through the 800 number that I mentioned before, 1-833-OSF-KNOW. There's an intake process that occurs immediately, and there's an army of individuals who have been trained to perform an interview and to enroll patients into the program to disperse essential materials, which can include a patient manual for how to care for oneself, hand sanitizer, the temperature thermometer, and even in certain cases when an individual doesn't have access to digital tools, to provide those digital tools. So this is how this program starts, but again, there's a continuity with a backup of nursing staff and physician staff to ensure that patients get the services that they may require, even if they become ill, that the care can extend further into the home.
This is from Mike at at the Quincy Bureau downstate. Governor, the Pekin Country Club decided to open their golf course to members, and many residents are concerned. Should they be shut down like golf courses across the state?
Yeah, I would suggest that this is not a time to loosen up the standards that you've set under this COVID-19 crisis, that we are just beginning to bend the curve here. This is a good sign, but this is not an indication that we should be letting up on those standards. We want to make sure that everybody is abiding by the stay-at-home rules, that they're in fact continuing even more so strenuously to follow the advice that's being given by the CDC as suggested, a mask, for example, and not gathering in public places in groups. So I would discourage people from using a golf course or from opening a golf course.
This question is from Hannah at the Daily Line. With this new at-home monitoring program, will IDPH be able to report the recovery rate? What's the best current estimate for the number of Illinoisans who have recovered from COVID? And also, how full are the ICU beds and ventilators, which I think we mentioned.
Dr. Zeke.
So in terms of recovery rate, we did put out 2 different surveys asking people to give if they were recovered 7 days after their positive test. And in the first time that we sent out the survey, I think we had a 48% recovered rate 7 days post a positive test, and the second time we ran it, it was 43. For the next reiteration, which we can do next week, we're going to extend it to have it 14 days after the positive test, and we'll be happy to extend and share that information as well.
This question is from Mark Maxwell, WCIA. In Kentucky, the governor ordered law enforcement to scan license plates of cars in church parking lots. In California, local authorities are allowing drive-in services. Should churches in Illinois meet in drive-in parking lot style services?
They should not. We're recommending against that, and I would suggest that this is just one holiday. It's one time, it's 1 year when I would ask people to do something that I know is unusual and uncommon for them, but it's to please stay at home. If you're going to attend services, please attend them virtually, online, even telephonically. It's much safer for you, and just as importantly, it's safer for the other parishioners, for your neighbors, your friends, for your entire community.
This is from Jim Haggerty at Rock River Times. What can Illinoisans do to help stop the false narrative that the Black and brown communities are biologically predisposed to COVID-19?
Well, listen to the facts. The facts are that anyone with hypertension has a comorbidity that works with COVID-19 against the person and makes it harder for them to recover from COVID-19. The same thing is true for anybody who has diabetes. We know people of all races, creeds, colors who have these comorbidities, all of us. And so it's not aimed at anyone in particular, at a person of color or otherwise. But it is also true that after decades, even centuries of underinvestment in medical care, in health care for communities of color, that this now shows itself in some of the results because people aren't able to access the kind of health care that they need, and the pre-existing conditions are a result of that underinvestment in many cases.
Rich Miller at Capital Facts. Shouldn't everyone at the podium be wearing masks when they're not speaking?
Thank you for asking that. We are all trying to be very careful to stay distant from one another. And it is not untrue that when you're gathering in a group of people that everybody might want to wear a mask. It is not a requirement, but I appreciate your pointing it out. I wear a mask coming from my office all the way here. As I'm leaving, I put on my mask. I think all of us are doing the same. We want to protect each other in that regard. And so, I think it's an excellent point, and I'd just say it's maybe an example to everybody else, or a point to make to everybody else, that masks are a good idea wherever you may be among a group of people.
This is from Bill at the Tribune. Has the state purchased or received antibody tests? If so, how many is it administering? Are they being distributed to local health departments? And how soon until these tests will be widespread throughout the state to determine who has contracted the virus?
I'm going to ask Dr. Ezike to come talk about that. I want to make one point about it, which is we very much want to test widely for antibodies, because this is part of the next phase of tracking with regard to COVID-19, so that we can know who's already had COVID-19, so that perhaps, as the evidence seems more and more to show, that those people might at least temporarily, if not permanently, be immune. But I want to turn it over to the doctor about how we're going to do that.
Thank you, sir. So again, to be clear, the current test that we're using is to identify who has the virus now. But as we get hopefully close to the peak and the plateau and hopefully start coming down off this curve, we have to be able to understand when we will be able to lessen some of the restrictions. Again, let's be clear, if we don't know who is immune and we just open up the doors and we all head out, that virus is still out there. And the people who have not contracted will still be at risk of contracting it, getting complications, and dying. And so all that will happen is that we will have delayed people's illness and complications and death. And so the idea is that we want to be able to identify what percentage of people in the community have actually had the infection, maybe didn't have a positive test, weren't formally diagnosed, but have actually had the infection. Maybe they had mild symptoms to almost no symptoms, and so it wasn't recognized, but however have developed the antibodies, which we think would be protective, and we think that the person would not get the infection again. And so we are working on a very robust program. We're working with some consultants and some university partners to try to get the antibody tests, and many are coming online. We have one that's approved now, and then we're waiting for additional tests to come online, because we are going to have to get hundreds of thousands, if not millions of tests in the state, and have a very robust way to calculate and identify all the people that are tested, so that we can identify the percentage of people in the state in various communities, right, from county to county, community to community, what is the percentage of people who have been exposed, to get at what would be essentially like the herd immunity. And so trying to figure out what percentage of people would need to have been exposed and have these antibodies, and figure out if enough If the communities actually have that requisite level of herd immunity, that is the important data that we need to collect in order to identify when we can start releasing restrictions and make sure that we're not opening up the state just to get further infection.
This question is from Dan at WBEZ. The president said yesterday that he has to make a big decision about opening up the country, but isn't that up to governors? What was your reaction to that?
It is up to governors. These are executive orders that have been put in place by governors, but it's also, maybe more importantly, up to the healthcare community and the scientists to advise us what the right thing to do is. And as Dr. Ezike said, it's very important to recognize that if you just literally flung the doors open and said, okay, everybody head outside, everything's fine now, we would, what do you know, head into exactly the kind of peaking that we're, that head once more to a higher peak of people who are contracting COVID-19. So it's very important for us to maintain, for the moment, the stay-at-home order, to make sure that people are following it, that people are wearing masks, that they're washing their hands, doing all of these things for a period of time going forward so that we can make sure that we're coming down off of that peak. And then, this is the point about the prior question that I would like to reiterate, which is we do need to test for antibodies, because that's part of the other side of this. When we're able to see a larger number of people who've had it and recovered, who have antibodies, we'll begin to, and when you've got treatment and you've got contact tracing, along with testing on the front end, those three things, right? Test, trace, and treat. When we've got all three of those things going, that is the moment that we can begin to start to open things up.
This will be our last question. It's from Shia at Politico. How will the end of the stay-at-home order look? What does a slow return to order look like? I'm imagining how gas rationing worked in the 1970s. And when will public schools return, or will they be closed for the rest of the year?
Shia wants to know everything all at once, and I do too, Shia. But I will just tell you that we don't know exactly what it's going to look like. And the reason is because until you have those three things I was just telling you about, more widespread testing, which we're working very hard on, contact tracing, which once again, there is technology that's being developed by Apple and Google you heard about, but there's also contact tracing that's being done the old, solid shoe leather methodology of just tracking down all the people that any particular person who has COVID-19 may have come in contact with and contacting them so that they can self-isolate. When you have widespread of both of those and a treatment that is available, that lets us begin to open things up. And so I'm very hopeful on all three of those fronts. I'm certainly working hard on the first two of those, that's testing and tracing. And of course, the issue of treatment is really up to the scientists and the researchers who are doing terrific work, some of which is being done right here in Chicago at our hospitals, where there are patients who are undergoing treatment by new kinds of drugs like remdesivir, and seem to be having some success with that. So again, I think we should all keep our hopes up that those things collectively, that we'll be able to make significant progress over the coming weeks.
Thank you, everyone.
Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.